And friends, the question is why medicine alone is not enough to control or cure psoriasis. This is a very important thing, and you must know the red flags because it is a commonest consideration of the people at large that whenever they get a disease, then they have to go to the doctor, take the medicine, treat it, control it, or cure it. And this is a very wrong conception people are having it because number one, if it is an infection and you get an infection, you go to the doctor, definitely with the medicine it will be controlled. But you must always think of not to get an infection again. So not to get exposed to the infection. Suppose if it is dengue and all these things, you should take a proper care so that you do not take the protection that nobody gets a dengue. And take the mosquitoes, take the proper care of the mosquitoes so that they are not spread. Another important thing that you also increase your immunity and you also prevent the infection. Then another important thing, there are diseases that are called as chronic diseases or hereditary diseases like diabetes, hypertension, or like a psoriasis. So how these diseases should need more than the treatment. So they can also be controlled by the treatment. Let us take the main example of a psoriasis. So psoriasis, if you come to the doctor, number one, if you go to the modern science doctor, he will first of all tell you that there is no cure for psoriasis. He can control it with its medicines. You take the medicines and then you'll be better. But next time you get the psoriasis, you come again, I will get the medicine. But to the best of my knowledge, it's my personal opinion, it's not sufficient. One has to find out the cause or the trigger factors that cause psoriasis in particular patient. Because although psoriasis, unless and until treated at the immunity level, it will never go. But definitely one can reduce the flare-up, one can reduce the severity by knowing the factors that cause the disease, that aggravate the disease. So one can manage it without medicines, and if one manages these things without medicine, the effect of medicine also increases and the need for the modern science medicines also reduce, and thereby they can reduce the side effects. But it needs a time to explain them. And major time one doctor may not have sufficient time to explain these patients. And that's the reason I have written this book, No Psoriasis to No Psoriasis, so that people can read this book, understand about the psoriasis and the factors in their lifestyle, in their diet, in their behavior that causes or increases their psoriasis. So they alone can do it along with the medication. So there are so many factors that can cause, aggravate, or precipitate the psoriasis that you yourself can do it other than the medicines. If you rely on the medicines and if you avoid these factors, you will need more and more medicines and your disease will increase. And what are those factors? Number one, in case of psoriasis, although genetic, it needs some trigger factors to appear on your body. And these trigger factors are stress, insecurity, emotional imbalance. There may be emotional setback, that is low failure in exams, loss of business, loss of money. All these things can bring a great stress, loss of job also. And that stress can create or aggravate your psoriasis. And if you know it beforehand, if you are having a psoriasis, if you know that these things can cause, definitely you can manage it well. Another important thing that psoriasis trigger factors are obesity, lack of exercise, lack of sleep, smoking, alcohol, wrong diet, processed preserved foods, and this can easily be avoided. So if you know that you have a tendency of psoriasis in your family, so if you follow all these things, you can delay the psoriasis. If you have a psoriasis and if you make these changes in your lifestyle about these things, definitely you can definitely minimize the psoriasis. You will need less medicines and you will get better effect with the medicines also. So all these factors are important. The next important thing I will say that once you get cured of psoriasis, once you get better of psoriasis, it is not that you should be free and you should say that, okay, fine, now I can do anything in life. No. You must know that these trigger factors are there. They can again cause you psoriasis. They can again land up in a problem. So you should train yourself. You should change your lifestyle, your health, exercise, the sleep pattern, so that you may not get psoriasis again. And the effect of medicine will last for a longer period. And This is not the duty of a doctor, but it is a duty to note down or to indicate to you that these things can cause psoriasis. You can find the expert people for this, so that you can find the expert dietitian, you can find the expert psychologist, psychoanalyst to manage your stresses, or you can practice some spirituality to manage your stresses, and that will not only prevent psoriasis, but that will also help you for your growth of mindset and all these things. So these things alone are not enough. Treatment alone is not enough to control and cure psoriasis, but the knowledge of this thing, and to be very precise at Psoriatreat, while we are treating the psoriasis with homeopathic medicines, we also take care of all these factors, and we guide to the best of our knowledge to the patients about the diet, about the psychology, about how to manage the stress, uh, how to deal with the insecurity and all these things, definitely to the best of knowledge, and patients are very happy about it. And that's one of the reason that patients get better faster, and for longer time they live without psoriasis and without medicines also. Thank you.